Testing. Blah, 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 blah.
Ready, set, go.
It's time for the Coach Amy and Coach Liz show.
A podcast for endurance athletes by two athletes, two coaches, and a physical therapist.
We are your hosts, Coach Amy
And Coach Liz.
coming to you from Kansas City. Hi, peeps.
We're here.
We're back for another episode of the Coach Amy and Coach Liz show. Liz, what did we do this morning? First thing.
Gosh. You got out your special little
What is my tool?
tool.
My otoscope.
You know what? I didn't even know what those were called. Your otoscope.
My otoscope. I was peering in Liz's ears today. So that otoscope is that thing your doctor uses to look into your ears.
I don't
with a
think I
nurse
knew the name of that
practitioner.
thing.
Yeah. Now you know. You've learned something special
do.
today. But, so why does Coach Amy have an otoscope? And why are you going to see it in the clinic?
I know.
So, I am taking this course. It's physical therapists in primary care. And it's learning those skills, assessing and screening our systems. So like the GI, the skin, the skin, which is called the integumentary system.
That's so cool.
And there's two key reasons why, this is important because, physical therapists, we are, frontline providers. So and patients access us directly. And we also get to see patients with greater frequency, usually sometimes up to 2 times a week, for months. Sometimes it's, once a month for months. And so we get to see them a lot more frequently than their doctors. We might be seeing them before their doctor. So it's important for us to be able to screen for medical conditions and identify serious pathologies so that we can then refer them to the appropriate healthcare professional, be it, a cardiologist, rheumatologist, their primary care doctor, so that they can get the care that they need. So, like, for example, there's an athlete that I had, a distance triathlete, she was coming in for, back pain, intermittent episodes, and we're kind of treating him and getting her over that. And then I noticed, gosh, we've got some skin eruptions here, kind of all over the body. And I'm like, this isn't, let me ask her about this, know? And as we got to talking about it, she had been to a dermatologist who was giving her creams that weren't helping her. This joint, kind of widespread joint pain, but intermittent back pain kind of occurring. And then these skin eruptions, red flag. To me, that was like, I think we need to send you to a rheumatologist to get some screenings and assessment to see, so that's just an example of where learning this and reviewing the systems and learning how to, look in an ear, for example. So today I was telling you that, somebody with neck and jaw pain that came in to see me for, maybe they've come in for an evaluation for this and thinking, physical therapy, that will help for this. But then, hey, are you also having ear pain? Well, yes, and there's some nerves that are shared with that. We've talked about that. And that's an opportunity to then use the otoscope to see, is there something that is a red flag in the ear that, okay, that's contributing or not. Rule it out, screen it out.
Which is so helpful because rather than having to wait or try to get into a doctor, which just seems to be becoming increasingly hard, to more hassle, you can just, at least address it in a perfunctory way right there. Just kind of get,
Yes, exactly. And, it's not just in the ear, but it's also, cardiovascular assessments, assessing blood pressure, heart rate, respiration, lung sounds, abdominal sounds, abdominal palpation, those kinds of things. I'm learning, why would I be looking at these things, what to be looking for, and then how to do it, properly. So we practiced with the otoscope today.
I mean, it's great. I think it's really exciting. Like, you just think about accessing, and you have pain and you're going to see somebody, who's working with all of the rest of your body, to have some of those. I think that's really exciting. Yeah.
I'm happy to bring it in. I've already found it helpful, and I'm not even done with the course.
That's cool.
Speaking of the course, here we are, because I have a final project.
Mm-hmm.
You remember finals back in school? Mm. So my final project is going to be this podcast. So And sort of the idea for this podcast is to our population that we're talking to, our listeners, our audience, is endurance athletes. And there is a falsehood held amongst medical providers that endurance athletes and runners are healthy.
That's so interesting.
Yeah, it is. And it's very, I understand it. I get it. But I've been to the doctor many times where it's like, oh, well, you're a runner. Yeah. You're good. You're good. You're healthy. And maybe some tests and measures aren't being completed because of that. This assumption. Those of us who are endurance athletes, compared to our counterparts who might be like more couch potato-y or, we do have a benefit. We have a benefit for our whole body on how exercise is helping with so many things in terms of our health. But we have to be aware that just because we are doing those things doesn't mean then that we have issues, that we don't have, diabetes, or that we don't have high cholesterol, or that we don't have a cardiovascular disease. It's not gone. It's not eliminated by being an endurance athlete. So I think it's really important for us to stay on top of it. Don't assume that you don't have anything wrong with you because you're an endurance athlete. Yeah. Okay. So Liz, I have examples of some athletes that have had some cardio. We're gonna lean towards the cardiovascular disease with in endurance athletes. Do you have any athletes that you know of that are battling that?
Yeah, we've had several different things like that over the years, and people that have been in endurance sports for a while, and yes. Is the short answer to that.
Okay.
Yeah.
In my run club, there's these athletes. I actually wasn't coaching or training them, but they run with our group. And over the last 15 years that I've been in charge of the actual run group part of thing, 3 athletes had heart attacks during a training season. Mm-hmm. Now, it wasn't while they were actually running.
Sure.
But one of them was training for a triathlon, and the other 2 were, running and training for, marathon, half marathon kind of distances. And all 3 required surgical intervention. And so, again, this is an example of you're not immune to cardiovascular disease or other metabolic and metabolic dysfunctions and things like that just because you're an athlete.
Well, and actually, it's kind of cool today because we're going to bring on our very first guest for our podcast, which is super fun. But he fits really well in with the story because he's a real life example of just a normal, everyday endurance athlete that has had a story that is, I think it's just good for all of us to remember and hear about.
Yeah. He's a really good friend of mine that I've had the privilege of, training with and going on group trips with for many years now. And his name is Pat. Pat is 63 years old. He's run 36 marathons in 34 states.
Correct.
And mentioning states, his long-term goal is to complete a marathon in all 50 states. And you were recently diagnosed with cardiovascular disease.
Yes.
Yeah. So thank you so much for agreeing to share your story with us.
My pleasure.
Okay. So to start things off, tell us about how you discovered running. Like, what motivated you to start? Because you didn't start as a high school, college athlete.
Yeah. So I ran a little bit in high school, but not in college. I wasn't an elite runner or anything like that. But when I got into my 20s, I realized that, I need to do something to keep myself healthy. Because of the family history that we had, I knew that it was going to be important to, maintain a good diet and also, have exercise in the plan. So I started riding bikes, and I really liked that for a while. But then someone came to me with a challenge of running a marathon. And it was in conjunction with raising money for Team and Training Leukemia Society. And so that's what really got me into running, was training for a marathon.
And how many years ago was that?
That was in 93.
Uh-huh.
Yeah. So, that's how I started, and actually started with Steve and Cynthia Hinman in Personal Best.
Yeah. which our group now is Roadrunners of Kansas City. But yeah, so
Right.
you've been around in our run group way longer than I have.
On and off. More off than on, I think. Well, maybe not recently.
I don't know.
But yeah.
Okay, so you began having some cardiovascular symptoms. What were your symptoms and when did you first notice those?
So I ran the Colorado Marathon, and the funny thing was, it was in 2018, and this was going to be the year where I was going to be super healthy. So I didn't drink at all the whole year, and I started a run streak where I ran every day at least a mile. Maybe that wasn't the smartest thing, I don't know. But we went with two members from our running group, Melody and Greg, and I was all excited that I was going to, have possibly a PR for my age at the time, and it went awful. The marathon was the worst marathon that I'd done up to that point, and luckily Greg and Melody were at the end because they realized that I was having a problem. I ended up being severely dehydrated is what happened there. But they also were concerned that I might have had some kind of heart episode. And so that's what kind of opened my eyes that, with my family history, that I really needed to be aware of, my heart, and that just running all the time wasn't necessarily going to be the, fix to make sure that I was healthy all the time.
Yeah.
So.
What were the symptoms that you experienced on at that race?
I started having pains in my back and up through my shoulder. And when you're running a race, and you don't want to think that, okay, I'm having a bad race all of a sudden, because, I was in the best shape I've been in a long time. And about halfway through the race, when I had those pains, I couldn't understand what was going on. So I rationalized in my mind that, well, we're running downhill. So maybe that's it. Maybe because I'm running downhill, I'm getting these pains.
Pain in my left shoulder.
Yeah. But when I realized about mile 22, as we're going through a park area, and I saw a bench, and all I wanted to do was sit down on that bench.
Yeah.
and I almost did. But that's when I realized that, at that point, towards the end of the race, that, there was something more serious going on.
Yeah. And then when you were in the medical tent, what did they do for you there?
They recognized that my blood pressure was real low. And
it was low at the time?
Well, yeah.
Okay.
It was very low because I was dehydrated.
Right. Mm-hmm.
And, but they did an EKG, and they wanted to take me to the hospital, but after they gave me the half a bag of saline, I felt like a new person, so I knew that, it's definitely a hydration issue. And I didn't think anything about it being my heart till a few weeks later when I followed up with my doctor.
Okay. So when you followed up with your doctor, what happened?
Initially, he kind of felt like it wasn't an issue.
Okay.
But as I continued to run and train, that pain that I experienced when I was running, the Colorado Marathon, I would have it, when my heart rate would get up, or I go for a long run, then I would have that same feeling again. And that kind of caused me to push my doctor a little bit more to run some more tests.
And that feeling that you were having was kind of that mid back into the neck sort of shoulder region on the left side a little bit.
Kind of a pressure, numbness kind of feel.
Okay. Yeah. And then that was associated with sort of intensity if you were to run harder or for a longer period of time.
Yeah, definitely.
Okay. All right. And then you mentioned a family history of heart disease. Do you mind sharing with us what
not at all. My father, he passed before he was 60 of a heart attack. My brother, who recently passed away in a car accident, but he also had already had stents. My older brother has had stents. I have another sibling that's had a heart valve replacement. So all of those things pointed to the genetic side of it, that, hey, I need to be aware.
Yeah. Hereditary factors that's a risk factor, right?
Exactly.
Then we have risk factor of your age. And then we'll talk a little bit more about how, I'll just say it right now, that, there's research, and I'm going to, in the show notes, I will have a a link to an article, because there's a lot of information and research now about how, especially as we get older, but these longer distance running and the endurance sport, there is some damage going on in the heart as well. So if we combine that with the other risk factors, that's the whole point of this this episode of the podcast, is to raise awareness about that and kind of symptoms that you might feel, and it's because it's not uncommon. Yeah. And then your doctor, the other point of the this episode too is that, and we talked about this at coffee the other day, how there's a perception that, as athletes and endurance athletes, that we're kind of immune to this. And it's a perception also held in the healthcare industry too, is just kind of, brushing it off a little bit and saying, no, there's no way you're healthy, you're a runner. Yeah. What was your experience with your doctor? And
my doctor pointed me towards some articles and some research that had been done about people that vigorously exercise for long periods of time and long distances, that later in life it shows that it's not good for your heart, hardening of your heart. I don't know what the medical term is, but, and so, and I don't have any of that. I mean, I did the stress tests and all the other.
Let's talk about your tests for a second, because I think that was like the stress test on the treadmill.
On the treadmill, and they did that, and they looked at my heart, and everything was fine in my heart, but I was still having that, so they went ahead and did another, I guess, a type of an MRI type scan where they
MRI of the heart,
and they open up your blood vessels with nitroglycerin and look into your arteries, and that's when they found soft plaque and I had some hard plaque in there as well. So, which isn't uncommon. It's not uncommon for people my age,
Right.
So, but it can be a risk factor for long distance running, and that's what really has opened my eyes. That is it what I want to continue to do? No doubt about. You got to exercise,
right?
And my doctor is by all means not saying don't exercise. He's saying consider doing 10Ks or 5Ks, but don't train to run marathons.
Yeah. When you tick off all the different risk factors, the state of your cardiovascular system, in addition to your age, the risk factors and hereditary, all of those things, if you consider all of that, maybe running. So when you're faced with that, how did you respond to that initially? That information.
It's disappointing because you set a goal, and goal setting for me is always been a way for me to accomplish things. I'm kind of that goal oriented kind of person. So when you realize that, well, this may be something that's going to keep me from doing that goal, I had to realize that, okay, well, I need to restructure what this goal is, and maybe it is doing something in all 50 states, but doing something different than a full marathon. And it impacts you, I think, emotionally and mentally a little bit. And it kind of makes you want to say, well, I'm going to give up, but you can't do that, because that's the worst thing you can do is just quit altogether.
Right. And become a couch potato.
Exactly.
Then your risk factors get even higher.
Right. I was reading an article about, the curve of that.
Okay. Tell me about that.
Well, it just talks about, the couch potato is on one end of the curve, and the person that's running hard and long is on the other end, and you really need to be kind of in the middle somewhere.
In the bell curve, where it's healthy for you, but not hurting you or harming you in the end. So what about, there was you're running with, what are you running with? That little nitroglycerin tab or something? You've got this little thing on there.
The last time I went to the doctor, and she was concerned that I was still having, that pain when I was running.
Because you do have the symptoms still.
Yeah, and I got the family history.
Yeah.
And so she kind of threw me off and said, well, I'm going to give you a prescription for this. And I'm like, well, what am I supposed to do? And she goes, well, if you're having a heart attack, you need to put one under your tongue and carry it with you all the time. And I felt like that old man in the movie, that was having the heart attack and he was pulling his pills out, and
you're like, I'm that guy.
I'm that guy. But so, my wife bought me a a couple of little containers to put on my keychain, so I keep.
So
it.
you're running with it. It makes me feel a lot more comfortable that you're running with it.
Well, if I drop over of a heart attack, you could give me one of them pills, and I should be good.
And it'll be
call 911 too.
It'll be okay. And I run with my phone, so that's good. But you put it in your pocket. Then you're running with it in your pocket.
Yeah.
Okay.
And kidding aside, I mean we're better off exercising and working towards a goal.
Yeah.
Than just saying, "Oh, I don't want to have a heart attack." I mean, it's rare that people that exercise on a regular basis and have a good diet are going to have a heart attack in a run.
Yeah.
And not saying it can't happen.
Right. And it's 100% agree with that. So there's something else that you're training a little bit differently. So when you're running now, you're monitoring your heart rate on you have a Garmin.
Yeah.
And so how has that changed how you're running?
When it gets up, it has a little zone, and when it gets up into the red zone, that means that for me it's up like over like 140.
Really?
Then I back it off and I'll start walking. So it used to be, the training and the running, the races where you didn't want to walk, but I mean, I've done a number of races now where, I'll run until my heart rate gets up, and then I'll walk for a while until it gets back down to 120 or whatever. Then I'll pick it back up again. So, and that's how I ran my last marathon, and I did a sub 5 hour. I mean, definitely not what I used to run.
Used to do, yeah.
But
it's kind of that, it's you got to change your mindset. That's hard to do, but you're doing great.
Yeah.
Yeah. There was another episode thing that you had, which was we all ran Maine together. That was a really fun group trip.
Okay.
And then we're all sitting around in this like couch pit. We rented this verbo. It was awesome. So we're all sitting around talking about this, and you're like, and you're looking up on your phone, I think I'm going to run Baltimore next weekend.
Yeah.
And tell everybody how that went.
Yeah. So we, doing the 50 states, if I'm in Maine and we're traveling down to see my nephew, who lived in Baltimore, and the marathon was there, I'm like, well, I'm just going to go out and do that. Why not?
Yeah. I'll take off another state. And this is also, was this before your nitroglycerin tabs and diagnosis and stuff, all the testing? Yeah.
I mean, it was after Colorado.
But it was years before you actually had.
Right. This was another eye-opening experience. So I went and did Baltimore, and about halfway through it, all of a sudden I was having vision problems. And I don't know if it was blood pressure or what was causing it, but all of a sudden my vision was all choppy. And so I could see that there was a medical tent right up there about the 10-mile marker. So I stopped in, and of course I told them what was going on. And they, tested blood sugar. They tested my, heart rate, of course, my blood pressure and all that. So, and everything was fine. And the funny thing was, I had stopped, waited there for about 5 minutes. I felt fine. The doctor that was there attending to me, couldn't see any reason why I couldn't continue. But she made me promise, because it was kind of an out and then you loop back around. That was about 6 miles to loop back around, that I stopped, and they let me, rechecked me again.
Oh, nice.
And I was fine. So, but the thing it taught me was that, my body wasn't ready, even though mentally I felt like, hey, this is a great way to knock off another state, so I don't have to come back out to Baltimore or Maryland. And but I shouldn't have done that.
Yeah.
In hindsight, I mean, it could have been worse. Who knows what it was? It was probably just my body saying, "Hey, what are you doing? You're still in recovery mode. You shouldn't be doing that."
Right. Yeah.
It's good.
Yeah. Oh my gosh! Thank you so much for agreeing to tell your story.
Absolutely, I'm happy to do it. Happy to be part of the run group too.
And we're happy to have you. Stick with us.
Yeah.
Well, to recap, I think it's important to catch the early warning signs of, when we're talking about the cardiovascular system, cholesterol and blood pressure, so that we can catch it when it's manageable with lifestyle changes, as opposed to later when we're going to be needing medicine or surgical intervention and require major changes that maybe affect your ability to participate in your beloved sport.
Yeah.
The way that you envisioned and planned.
So what are things that we should be doing as athletes, or what can we do?
it is important to not assume that you are just 100% healthy because you're an endurance athlete. That's number one, is just acknowledging that, hey, I'm not immune, right? I think it's really important to know your family history. I know mine, but it's surprising how many people do not know their family history, and it's really important. Get regular screenings for your heart, blood pressure, blood work for, blood sugar, cholesterol, etc., all that stuff. And communicate. I've got this in all caps here. Communicate with your doctor or healthcare professional and ask them to explain your readings and results. Are there early warning signs? Do you have symptoms of issues? If so, push and advocate for yourself on further testing and measures. Don't be afraid to do that. And don't be afraid to switch doctors if you feel like this doctor's not working for you, or that they're not listening to you. And, lastly, if you're among the large pool of endurance athletes, because it is larger than you would think, who are managing cardiovascular issues, that require modifications of your endurance activity. So maybe you don't get to run full marathons, or maybe you don't get to race anymore. Know that you are not alone, and listen to your body, make the lifestyle changes that you need to make, and give yourself some grace. Embrace those changes, whatever they may be, because, living long is desired, but living well during the lifetime is kind of our ultimate goal.
Yeah.
Thanks so much for listening. And remember,
we are in this together. Until next time.